Assalamualaikum doctors. In this video, I am discussing chest pain history. How can we manage? First, I am telling the differential diagnosis of chest pain. These are on the headline. First of all, cardiac causes are it can be pericarditis, post-pericardiotomy syndrome, pericardial effusions, coronary artery thrombus, bacterial endocarditis, myocardial ischemia, any cardiac disease like congenital heart disease, chest. Respiratory causes are pleural effusion, pneumothorax, pulmonary embolism, pneumonia, COVID, acute chest syndrome. Musculoskeletal are costochondritis, trauma and deformities. Gastrointestinal cause, GERD, psychological and drugs. So chest pain history, how can we evaluate? I am telling. First, detailed history and examination I take, then baseline observations including the blood pressure and oxygen saturation. So blood pressure, oxygen saturation I will check. 12 lead ECG assess the rhythm, signs of the myocardial ischemia, ventricular hypertrophy, corrected QT interval. Then chest X-ray, consider it acute severe chest pain associated with fever and cough, post-chest trauma, abnormal respiratory examination, abnormal cardiovascular examination. So I will examine the child. Chest X-ray, chest examination, cardiology examination, respiratory examinations. Is there any abnormality present or not? Management of chest pain, it is according to its grade, mild, moderate and severe. We can tell red category, amber category and green category. So red category, I am telling what history we find. Recent cardiac surgery less than 2 weeks, Marfan syndrome, Kawasaki disease with coronary aneurysms and hypercoagulable state. Here we find abnormal history, abnormal examination and abnormal 12 lead ECG. Our management is prompt discussion with the either pediatrician with expertise in cardiology or on-call pediatric cardiology center. So red flags we find, immediately we send in the cardiology center. Amber category are chest pain with exercise, radiation, palpitation, syncope, known congenital heart disease, known acquired heart disease, previous cardiac surgery and family history of sudden death. That is amber category. Here we find abnormal history but normal examination, normal 12 lead ECG. Our management is discussed with the pediatrician with expertise in cardiology and refer to pediatric cardiology, outpatient department, local or tertiary. Then green category, we find everything normal like chest pain, but chronic history of chest pain. It is a long history, local tenderness, worse with the breathing or movement, worse with cough or wheeze, worse with eating or posture, triggered by the anxiety. There is normal history, normal examination, normal 12 lead ECG. We will reassure, give analgesia, NSAID for costochondritis, PPI for if gastrointestinal cause, and if recurrent, general pediatric follow-up. So this is chest pain management. So normally come on exam, that is, I'm telling if it is costochondritis, come, what is costochondritis? That is a costochondritis, also known as chest wall pain syndrome or costosternal syndrome, is a benign inflammations of the upper costochondral and sternocostal joint. Risk factors are strenuous coughing, exercise, lifting, infections of the costosternal joint. So any trauma, lifting heavy things, vigorous exercise, strenuous coughing, we find in costochondritis one of the DD, remember, we tell. Psychogenic chest pain, it can be, if it is psychogenic, what we do, involve the psychologist, cognitive behavior therapy, family counseling, not give pressure during exam. I will do the respiratory and cardiac examination. Always do the respiratory, cardiac examination, blood pressure, saturations, ECG, chest X-ray, these are the we do. And then red category, amber category and the green category according to we manage. Thank you.